Afternoon on your end. Good morning here. I just wanted to ask, well, how are things on your end? And I'm pretty interested in this topic.
Yeah, everything's going great, Brian. Thank you for having us. I'm Dr. Montes representing Organon, and we're here to talk about contraception, particularly with Latinas.
Oh, okay. So I'm a bit intrigued. How serious or
Mhm.
how is the problem there with as far as Latinas in terms of birth control and orienting them with it?
Sure. I think, unfortunately, just in general, the rates of unplanned pregnancies are still high.
Mm-hmm.
Um, we are seeing, though, even though the rates are still high, though, we are seeing that over the last 40 years, women in general, but especially Latinas, are making significant gains in their education and in workforce participation. So, with that being said, they definitely want to have more control of being able to plan for their future, being able to plan for their families. So, right now, it's very common that women are wanting to talk about contraception and seeking out that conversation with their physician or their healthcare provider.
So how do you do it? I mean, well,
Mhm.
I've dealt with it before with my wife here in the Philippines. I mean, how
Sure.
do you make that in a way that they don't feel uncomfortable to understand why it's unnecessary?
Yeah, that's a great point. So I think the way to just kind of start for women to know to start that conversation, it's important to make sure that you're seeing a provider or a doctor that you trust, of course, someone that you feel comfortable with and that you can have an open and honest dialogue with, and to know that all questions are welcome. There's no question that we wouldn't want to answer because that may help you make a decision based on what the option that that will be best for you. But I think it's also important for women to kind of have an idea as to how many children they would like to have, kind of spacing out of children, or even if they really don't want to have any children at all. And then it's important to talk with the physician or the provider about your medical history, your lifestyle, kind of what your schedule looks like. And then also make sure that you ask about any side effects or any, if you've had an experience in the past with a certain birth control, it's important to bring that up so we can kind of take that into account when we're making the decision.
Just curious, out of the of the girls that you've been able to talk to,
Hmm.
is there something? Does this have something to do with their upbringing, their culture? I mean, why they end up with these unwanted pregnancies?
Yeah, that's a great point that you're bringing up, especially with Latinas. It's we've kind of grown up in a society or a culture where it to talk about sex and birth control, especially being of certain religions, these women really haven't heard of these things. So when they're thinking about it on their own, sometimes you can think of from when they were young and their parents would say, don't talk about sex, don't talk about birth control, that's bad. Or, they put certain misconceptions in their heads or in their minds about it. I think that they kind of take that into account as they get older, and they think, oh, well, I shouldn't talk about it, or I shouldn't bring it up with my doctor because that's a personal thing.
Mm-hmm.
But in reality, we really want patients to bring that up. And that's especially OBGYNs or primary care doctors who deal with contraceptive counseling on a day to day basis. We really want to bring that up. But I think it's important for the physician to ask them, uh, which I tend to do, of course, with all my patients, even if they're not there for contraceptive counseling, but it flows with the reason why they're there. It's important to bring that up and just confirm that they know the options, and if they want to talk about that or not that day.
Is there a certain age group? I mean, at what age, based on your how you've been dealing with them, what's the age group that's really affected by this issue?
Yeah, as far as age group in terms of the unplanned pregnancies, I feel like it can be mostly teens, but in reality, I mean, I still see some patients who are older and have actually had children, and they've had a surprise pregnancy because, of different varying factors. I think with COVID too, there may have been more unplanned pregnancies because
Mhm.
of the fact that, women weren't going to their doctor's offices, and they didn't have a way to gain or didn't have a ability to have the appointment made for them or be able to attend the appointment. But it's important for women to know that COVID has actually changed medicine for the good. Like, we're doing more appointments on telemedicine, and even a contraceptive counseling appointment can be done on telemedicine. So there's really not a reason to be able to see or talk to your physician or your provider. But yeah, I think overall it's mainly that age group. And so, I think talking about it and kind of bringing this to the forefront and having an open dialogue, and you writing about this is important, so so women can have that kind of idea in their mind to talk to their doctor about it.
Okay, you mentioned about COVID. We all know that there's a mental problem that this pandemic has brought up.
Right.
Has this contributed? I mean, did it make things harder? I mean, like you said earlier, it
Mhm.
sort of increased or something like that, the unwanted pregnancies. Is this another factor we have to consider?
Yeah, I think so. I mean, I feel as though COVID, just really affected not only people's physical health and also their mental health, but maybe that mental part made women feel like they didn't want to, that it was going to be, they kind of put their health on the back burner possibly. And um, so yeah, I think it affected women in kind of different aspects of their physical and mental health for sure.
Okay. So, what is your best advice right now? I mean, for those who
Yeah.
are dealing with this problem, what's
Hmm.
your best advice to them? What can you give?
Um, well, as far as contraception goes, I mean, I think if you have a doubt about any misconceptions regarding a certain birth control, but you really want to try it, or you've heard a story from a friend or a family member, it's important to definitely bring those questions to the visit. And then also, kind of like I mentioned before, think about what your goal is out of birth control, and what your plans are as far as your future family planning. um, and then kind of take those ideas with you to your visit, so that way you can let your physician know.
Do you have any idea? I mean, usually when they get pregnant at an early age, some do not really end up. I mean, end up with happy lives. There are single parents and everything like that. Do you have an idea how huge is that in the Latin community?
I think, like I mentioned before, I think that unfortunately the unplanned pregnancy rate is a little higher in the Latina community, relative to other races. But on the same token, we've seen college enrollment rates for Latina ages between 18 and 24 increase by 15%, from about the year 2000 to 2018. So over the last 20 years, excuse me. So I think we do still see it in certain communities that maybe have less access to information about contraception, or maybe they are still in that, have that cultural taboo more so than other communities. But in general, I mean, seeing this increase in women wanting to have a, a more success in education and in careers, I think that we are making a headway there. So that's promising.
Okay, for my last question, I
Yeah, go
mean,
ahead.
what impact does this have on the offspring? I mean, the child that they're carrying. Eventually, long does this carry on?
Sure. Yeah. I mean, I think in general, you tend to see kind of like a generational effect, is what I would say. But I think it also starts with the family and parents talking to the female about birth control and sex, and kind of bringing that up at an early age. Of course, that's a another topic or another discussion to have, as far as parents talking to their kids about birth control and sex, and just kind of making it known as to how all that goes. But I think in general, yeah, it can be generational.
All right. I think that's it. Thank you so much, Doctor.
Montes, yeah, thank you,
Yeah,
Brian.
yeah, I'm a very good insights.
Oh, okay, thank you. Well, you
Yeah,
have a great day. I appreciate it.
you too. It was a
Thank
pleasure.
you,
Thank you.
Brian.
Thank you, Carla. Thank you
Thank
also.
you so much. Thank you.
All right.
No, I
Thank you.
can I can send you the recording soon.
Yeah, okay, no problem. Just let me know. You know my email anyway. And
Great,
hopefully,
perfect. We'll keep in touch.
yeah, in the future, maybe I can also talk again about other topics with Doctor.
Yeah, it
Yes,
sounds
of
good.
course.
Yeah. Okay. I hope you like what I'm gonna write, though.
I hope I will too. No, I will.
All right. All right. You
No,
take
Thanks,
thank you
care.
Brian.
everyone for your time.
Right.
Appreciate
Bye.
it. Bye.
Bye.